When he was 3 years old, he got very sick and had to go to the emergency room. His blood sugar level is over 600. Normal is 80 to 100, and he nearly went into a diabetic coma. The doctor saved his life, but diagnosed him with juvenile diabetes. Before Jacob can eat breakfast, lunch, or dinner, we must poke his fingers and draw blood to check his blood sugar. Then we must count how many carbohydrates are in every bite of food he eats and calculate both to know how much insulin he needs in order to eat every meal. Too much or too little can make him very sick, sick enough to pass out in a coma. The school nurse checks Jacob's blood sugar before every PE class to make sure he is not too low so that he can participate. His parents must check his blood sugar while he is peacefully sleeping every night around 2 a.m., sometimes more than once, to make sure his blood sugar isn't too low and make sure he is still alive and not in a coma. If he is low, he must be woken up and given juice or a snack to correct the low. His tiny fingers are poked about 8 to 10 times every day and are calloused. He will have to do this for the rest of his life, unless we find a cure. This blue object is an insulin pump. It is about the size of an iPod. The pump injects insulin into Jacob's body before each meal he eats. It fits into his pocket or he keeps it in a waistband made for pumps. He must wear this pump all the time, even while he sleeps. The blue clip on the right attaches to an injection site on Jacob's body. This patch is what the pump clip connects to. The tip goes into Jacob's body by poking his skin with a large needle. This patch is poked into his abdomen, about 3 inches from his belly button, or on his backside, about where pant pockets would be. They have to rotate sites because the tissue under his skin is getting damaged from so many pokes that it will not absorb the insulin. His site must be changed every 3 days for the rest of his life, until we find a cure. Juvenile diabetes affects millions of children, and more are diagnosed each day. There is no cure, and over time, if he doesn't take care of himself, he could go blind, develop heart disease, lose his arms and or legs, or even develop kidney failure. Thank you for your interest in his story, and I hope you learn a lot so you can help save lives by knowing about the disease. Remember, if you ever need a helping hand, you'll find one at the end of your arm. As you grow older, you will discover that you have 2 hands, one for helping yourself, the other for helping others.